Here is the big story that we are covering in the healthcare reform debate. The pros and the cons of healthcare have given way to the pluses and the minuses. I am talking old school math. Of the 431 current members of the House of Representatives, 253 of them are Democrats. The rest are Republicans, but at the very most, only one of those Republicans is even considering voting yes. He voted yes last time, and he says he still hasn't decided. So let's just talk, for sake of argument, about the Democrats. 29 Democrats are on record as planning to vote no. That leaves 224 behind who either plan to vote yes or who are undeclared. It takes 216 votes to pass or defeat the bill. Supporters can afford to lose 8 more votes at the most. Okay. And I've got a chart next to me that I just want to show you. We are keeping track of this. So there are 33 people in play, shall we say. The magic number is 8. They can lose 8 of these. Every time somebody says they are voting yes or no, we're going to cross out their name on this board. And the names that are left are those people who are in play. You can imagine that the administration is going to be paying very close attention to them. Nancy Pelosi and her team are paying very close attention to them. And we have heard that the president is meeting with the Democratic Congress at the White House tomorrow, Saturday, ahead of what is planned to be a Sunday vote. Connecticut Representative Joe Courtney is a 2-term Democrat. He has been and is on our board in the undecided column. He's been there for weeks now. He joins me from Capitol Hill, and I understand that he is no longer undecided. Congressman, tell us your decision.
Sure. Thanks, Ali. When the time comes for this vote to be held in the House, I will be a yes vote. We've spent the last 24 hours reviewing the package, which was finally released yesterday afternoon, as well as the CBO score, and I'm satisfied that there are adequate changes made to the Senate bill, the base bill, that address the issues that kept me in the undeclared column.
Okay, you mentioned 2 things. One is you mentioned the CBO score. That's the Congressional Budget Office estimate of the cost of this program over the course of the next 10 years and beyond, and you mentioned other changes. What tipped you over?
Well, when the Senate passed its bill on December 24th, they, in my opinion, did not do a good job in terms of fixing the Part D prescription drug benefit. They left a donut hole for seniors, which is something that I have worked on for 20 years as both a state legislator and as a member of Congress. They had the special deals under the Medicaid program, which were unacceptable. And they also had a pay-for, which was the excise tax on so-called high-cost health plans, which I've led the charge in the House over the last 6 months. I organized a letter with 192 other members of the House opposing this plan, which we did not adopt when we passed our bill last November. And the changes that were made after months of negotiation, pushing the tax out to 2018, deleting vision and dental coverage from being exposed to the tax, as well as providing people a safe harbor by allowing access to purchasing exchanges in 2017 so people would have a fair way of avoiding the tax, in my opinion, was a fair compromise and was sufficient to sort of tip my vote in the yes column.
Congressman, are you comfortably in the yes column now? You've decided this is where you're going to go.
Absolutely. I mean, there's no question this is a milestone moment in our country's history. I do believe, as someone, again, who worked on health issues at the state level, you've got to get the right balance. And when we saw the language yesterday, I think we've struck that balance, and it's time now to move forward. And there'll be years of opportunities to tweak and fix, just like we have with Medicare, been amended over 30 times since it was passed in 1965. But you've got to take that first milestone step, and I think we're going to do it on Sunday.
You're a 2-term congressman. You a little concerned that you have now voting yes in a state that is heavily influenced by health insurers who are not happy with the way this bill is looking right now?
It's, obviously you've got an important job to listen to your constituents. Again, as somebody who's worked on this issue at the state level for many years, I have worked with insurance companies. On balance, I think these purchasing exchanges are going to provide them with an opportunity to sell their product. It's going to be a more stable market, just like it is for the federal employees that members of Congress use that plan. And I think this is going to allow coexistence for private health insurers in a system where people, I think, have basic access to quality health care.
Not sure if you've received the information or the invitation yet, but we understand the president is inviting you and your colleagues, the Democratic caucus, to the White House tomorrow for a last-ditch effort. Looks like, I'm not going to guess. What do you think this looks like? Do you think this bill is going to get passed on Sunday?
I mean, we've still got some work to do, and I think it's good that the president is getting people together for a final push. At the end of the day, we've been told we're not going home until we get this done. I personally feel that for the sake of the country and people who are suffering out there, that failure is not an option, and we've just got to keep working at this until we hit the magic number of 216.
Representative Courtney, are you one of these guys who, because you were a late ad into the Yes column, are you getting some invitations, pressure, whatever you want to call it, to start making calls to other people or to tell people why you are comfortable with this and maybe bringing them over with you into the Yes column?
That certainly has not been a request, but the conversation is nonstop on the floor, as you can imagine. And certainly, as somebody who led the charge on the excise tax issue, I feel that sharing my perspective, which again many members kind of joined onto over time, I think is going to help give people more of a comfort level about whether or not that is going to translate into a middle-class tax, which I believe at this point it will not.
Because after you, there are 32 more who are sort of in that category, and some of them may share your particular concerns. There are others who were just concerned about the CBO number. Others had yet other concerns, but some might be swayed by the information that swayed you. Absolutely. And I'll get out there and make sure they know my perspective on this important issue, which was really, it wasn't always the front top of the fold story about health care, but the pay for, I think, was a profoundly significant issue that there was a tug of war between the Senate, the White House, and the House for months over this issue. And again, I think we've struck a good balance to resolve that issue. Well, whatever your decision is, whatever people think about it, Congressman, I think they'll appreciate the thought that you put into such a major and important historic piece of legislation. Congressman Joe Courtney is a Democrat of Connecticut, has just declared that he will, in fact, be supporting health care reform on Saturday. Thank you, Congressman. Thanks,